Measuring Progress in Your Community. My name is Jan O'Neill, and I'm a community coach with the County Health Rankings and Roadmaps program. And I'm joined by two of my colleagues. Amanda Jovaag, Data Team Lead, will be co-presenting with me as we talk about how to use rankings measures, where to look for other data that can help you tell your community's story, and tools for assessing your community's readiness for taking the next steps. Kate Conkle will be helping to answer your questions, as well as sending some links out via the chat box throughout the webinar. Before we get started, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. Kate?
So we want to take a moment to get you oriented to the technology that we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window where you will see our screen throughout the presentation. And on the right, you can see the control panel, which is where you can interact with us. Because of the number of people we have on today's webinar, we will be taking questions via the control panel, and I will be monitoring those throughout the webinar. So feel free to enter your questions at any time. I may be answering some throughout the webinar, and others will save for the Q&A towards the end.
Great. Thank you, Kate. So let's take a look at our agenda. Here's what we're going to talk about today. We'll start with a quick review about why we rank and some cautions about using ranks as a way to measure progress. We'll then provide some guidance to help you be purposeful about what and how you measure progress. Next, we'll dive into the rankings measures, taking a look at how and what we analyze for trends and other data sources. We'll then move to a self-assessment tool for measuring where you are as a community in improving health and where you might want to focus next. We'll have time for Q&A, and then we'll wrap up with a few ideas about additional tools and resources. Let's find out first where you are on measuring progress. I'm going to launch a rapid response poll. So please take a moment to answer, and you can provide more than one answer if it applies. Great, thank you for responding so quickly. We like to get up to about at least 80% of you having voted. So we'll give you another few moments here. Okay. Okay. Got about, we're at 76, 77% have voted. I feel like I'm doing dialing for dollars here. Okay, so I'm going to close this poll, and let's look at results. So 16% of you haven't started yet, and it looks like most of you are using data from the measures that go into the rankings, and you're also using other sources. But a good number of you are using the county's ranks. So Amanda and I will be talking about that and some of the precautions with doing that. So hopefully this will be a valuable webinar for all of you. Great. So let's get to our essential question for today. We've heard many community leaders ask this question: how can our community measure how we're doing on improving our health? Knowing that there's many ways to do this and one size may not fit all, we hope that this webinar will provide guidance to help you see if you're on the right track and where to go next. So let's first start with a quick review of what and why we rank in the first place. Each year, almost every county in each state is ranked for health outcomes and health factors, with one being the best in both cases. And the measures we use to rank each year are based on a population health model. This year, we're using 34 measures for ranking counties, from measures of tobacco use to access to care to education to housing and transit. Why do we rank? We rank counties within states to provide community leaders, all of you, with a tool for calling your communities to action. When the reports are released each spring, they garner a lot of media attention, which provides community leaders with the leverage for mobilizing multiple sectors to get involved in taking action collectively, action that is evidence-informed and focused on the community's health priorities based on the data, action that will ultimately, over the long term, result in longer, higher quality lives for children and adults in your community. So health outcome and health factor ranks are great for garnering attention, simplifying a lot of complex data and making comparisons between one community and another at a point in time. But because ranks are relative, they aren't as helpful in isolation. Your county's rank depends not only on what is happening in your county, but also on what happens in all other counties in your state. In fact, if every county in a state improved its health at the same rate, everyone's ranks would all stay the same. So look for ranks to inform your progress measurement, not drive it. Ranks are one tool among many. In this webinar, we'll be introducing you to other tools as well that you can add to your toolkit for measuring progress. You'll find much of what we covered today in a new guide we've added this year, Measuring Progress. We'll also be referencing tools from using the rankings data. So, Amanda, before we dive into the other tools, can you first talk about how we can all get ready for measuring progress?
Sure. Thanks, Jan. It's not uncommon to jump into measurement only to discover you're drowning in data and starve for information. So a few precautions are in order. First, communities should take a step back and consider what your purpose is and who you are measuring for. Is it to learn from what's working and not working so that your partnership can adjust strategies and make the best use of limited resources? Is it to capture what's working so you can disseminate this information to others, expanding the strategy to others? Is it to be accountable to funders for the results of their investment in your initiative? Is it to communicate your story in order to inspire and motivate others in your community to join you, to take action? Maybe it's all of these, but being clear on your why and for whom will help you identify which measures to use, their connection to your improvement strategies, and over what time frame the measurement will occur. I'm going to give a little example here. City officials in Milwaukee were able to announce last fall that Milwaukee's teen birth rate dropped by 50% over the past 7 years. The initiative grew out of concerns that children born to teen mothers are more likely to become teen parents themselves and are more likely to drop out of school, tap into public assistance, or go to jail. The city and a group of community partners set a goal in 2008 to reduce Milwaukee's teen births by 46% over 10 years. At the time, Milwaukee's teen birth rate was second only to Philadelphia among the nation's 50 largest cities. Officials attributed the declining birth rate to the unprecedented, all-hands-on-deck approach of the city's teen pregnancy prevention initiative, which has been honored nationally as a model for other cities. These leaders had a clear goal in mind when they started. They selected specific strategies to try and measure their effectiveness along the way so they could adjust what was working and stop doing what wasn't. They knew this was a long-term goal, so they also measured the actual impact of their strategies, the drop in teen births. In addition, they wanted stakeholders in their community to understand the connection of teen births to the cost of dropout rates, employment, and crime, so this became a part of their communication messaging. So, before you dive into measuring progress, it's important to be clear about the geographic focus of your measurement. Is it a municipality, a school district, multiple counties, and specifically who within that area? All people, those most vulnerable and without resources? Think about whether it's important to compare to a particular point in time and differences between the haves and the have-nots.
Think about whether you're focusing on a specific health factor, whether it's in health behaviors, clinical care, social and economic factors, or the physical environment. The more specific you can be with your questions, the easier it will be to find the data you need. Also, it's important to keep in mind that change takes time. Be realistic about how quickly you can move the needle. It will take time for your efforts to improve your health outcomes. For example, when you reduce your adult smoking rate significantly, it will take some time before this positive change reduces the number of preventable deaths due to smoking. When you increase high school graduation rates, some effects will be immediate, but it will be years before premature deaths are reduced. Also, most data collection by a census or survey has lag times. For example, our premature death rates represent a lag of more than 3 years, and to be sure we have reliable data for communities of all sizes, we use 3 years of data. So the premature death rates you see for the current rankings reflect premature deaths from 4 to 6 years ago. As you define your community, it may be that it's not the county as a whole. You may be interested in just one city or neighborhood or school district. It's important to remember that not every type of data can be broken down into identical local units. For example, school data can generally be broken down into district or local education agency or individual school levels, which can roughly translate into cities or neighborhoods, but not always exactly. Crime statistics can generally be broken down by law enforcement agencies, which often correspond to municipalities, but not always. Social and economic data often comes from the U.S. Census Bureau, and the lowest levels are often census tracts or census block groups, which can be similar to zip codes, but are not necessarily identical. So, what should you look at when it comes to measuring progress? One way of examining how much progress your community has made on its journey to better health is to look at the various individual measures in the county health rankings. You can get an overall sense of your overall progress toward becoming a healthier community by looking at the individual health outcome measures for your county, which include measures of how long people live, the length of life, and how healthy people feel while alive, the quality of life. We call these measures today's health for a county. And to see the impact of your work to address the many health factors that influence your health, you can look at individual health factor measures. Health factors in the county health rankings represent what influences the health of a county. We measure 4 types of health factors: health behaviors, clinical care, social and economic factors, and physical environment factors. We call these measures of tomorrow's health for a county. There are currently 12 measures with trend data available: premature death, preventable hospital stays, diabetic screening, mammography, sexually transmitted infections, unemployment, air pollution, children in poverty, uninsured, violent crime, physical inactivity, and obesity. There are at least 3 types of questions you will want to consider for each of these measures. For each of the measures where sufficient trend data is available, you can view a detailed graph of the trend data by clicking on the graph icons. We've color-coded each to help you answer question 1. Red means your county is getting worse for this measure. Yellow means your county is staying the same for this measure. Green means your county is getting better for this measure. In this example, preventable hospital stays in red in Richland County, South Carolina are decreasing, so this measure is getting better. While preventable hospital stays in both the state and the nation are also decreasing, Richland County is keeping up with their progress. On the next 2 slides, I'm going to talk about some. You can find this data in your county snapshot. I'm sorry, I went ahead a little bit.
We just wanted to make sure that you could see that what Amanda was talking about here is when you go into your county snapshot, there are 12 measures that we have trend data for. And when she was talking about the green, that's showing that for that measure, the trend is getting better. If it's showing yellow, it's about the same, and if it's red, it's getting worse. So you can click on the trend graph, and we again are showing the same example. And what you'll see pop up is the preventable hospital stays that Amanda was referring to.
Okay. So on the next two slides, I'm going to talk about some pretty specific data issues. It's probably going to get a little wonky, but bear with me, okay? What about other measures where there aren't any trend graphs? Data within the rankings has many different flavors. It comes from about 25 different sources that use different rules or mechanisms for constructing the estimates we provide. Those differences prove very important when it comes to estimating trends. You would want to ask yourself as you're looking at these data, is the measure estimate a single-year estimate or a multi-year combined measure? For measures that represent a single year, our trend estimates may be the best available. However, when multiple years are combined together in the rankings, for suppression and stability reasons, we lose a great deal of analytic power for assessing trends. For example, we use 3 years of combined data to measure premature death. That means we can only use 1/3 of the total estimates, leaving out overlapping years. However, many counties should be able to access annual estimates of premature mortality within their state and would have much greater power when testing for trends. You also want to think about whether the data is a census or a sampled estimate. Census estimates, I'm not referring to the U.S. Census Bureau. I'm talking about whether or not it represents the entire community or a sampled portion of the community. In that case, sample sizes are generally larger with census data, and one doesn't really need to worry about how well the sample represents the population of interest. You can measure trends with census data without applying weight that need to be applied to sampled data. You also want to think about if the data is raw or modeled. Modeling, which is used in many of our estimates, can improve the precision and stability of estimates when raw data is somewhat lacking. However, the variables used to create these models often have smoothing effects that can mask variability from year to year, creating a stronger tendency for trends to be found. I'm going to talk now a little bit about two particular surveys that we use a lot in the county health rankings. 12 out of the total 34 measures included in the rankings are drawn from either the Behavioral Risk Factor Surveillance System or the American Community Survey. They're a vital source of community-level data. However, to create estimates for the greatest number of communities, we needed to combine multiple years of data, 5 years for the American Community Survey and 7 years for the Behavioral Risk Factor Surveillance System. This creates a real problem for measuring progress towards better health. For both of these surveys, however, many communities can access better trend data than what we are using. For the BRFSS, the coordinator in your state may have access to better data for your community, including county-level oversamples or fewer combined years. For the American Community Survey, if your county has a population greater than 20,000, you will be able to access 3-year combined data, and if greater than 65,000, single-year data. Both of these will be far more useful in measuring progress than the 5-year data we currently have available on the county health rankings. Okay, now we're going to show a brief example of how our data, when combined with locally available data, can highlight success stories in your community. The rate of violent crime in Hillsborough County, Florida, has been nearly cut in half over the past 10 years. Imagine that a coalition is trying to describe and highlight the work that has been done and the outcomes they've found. They start with the county health rankings data. However, this coalition knows that we combined 3 years of data to construct our violent crime measure, and that Hillsborough County is made up of more than one law enforcement agency. So some digging would be needed. So what I'm going to take you through is some thinking about how to do a day-to-day. Don't worry about the specific numbers on the slides. They're going to be small. Instead, I invite you to follow along with the logic as I pose questions and do a day. A quick Google search showed that Hillsborough County is home to the city of Tampa Bay. I found an article demonstrating the annual decreases in crime in the city of Tampa Bay. However, that data only looked at Tampa and only went as recently as 2012. So I searched for crime statistics for the state of Florida and pretty quickly found annual violent crime reports for Hillsborough County and the rest of the counties in the state, and the law enforcement agencies that serve the population. Further searching uncovered a press release from the Hillsborough County Sheriff's Office which showed continued decreases into 2013 and outlined some of the programs being undertaken in the county that might account for these big improvements. This story demonstrates how the rankings can be a jumping-off point for measuring progress, but that other data should also be accessed to paint a more detailed picture of progress in your community. So the rankings are just a starting point for assessing your county's health. Depending on which state you live in, there may be more current data available, or there may be data for important drivers of health that are not included in the rankings. Visit your state homepage to look for other sources of data to help you examine progress. You might also want to look for data that's broken out into different subgroups. Just because your overall health is improving does not mean that health is improving for every population group in your community. You should also check your own county snapshot under additional measures to see what's available at your county level. Now, I'll turn it back to Jan to talk about other tools for measuring progress.
Thanks, Amanda. I learned a lot just listening to you there. That's great. On our site, you'll also find other resources to help you figure out how to approach measuring progress in your specific community. Many of these are found in the Community Toolbox. For example, the Community Toolbox provides a helpful overview of how to find and use community-level indicators. And as you select your indicators, consider whether they're available, accurate, whether they're possible to collect data for, and if they're relevant to your initiative. Also, Community Toolbox has a great guide for gathering information and monitoring your progress, guidance that can help you monitor process and outcome measures. Sometimes other sources of data won't be available, and you may find yourself needing to do some primary data collection. If this is necessary, we strongly recommend that you contact your state health department or a local university to assist you. Also, consider conducting surveys from Community Toolbox to better understand the pros and cons of this data collection method. So finally, let's take a brief look at a tool that's more qualitative for measuring your community's readiness to improve health. Numbers alone don't tell the full story about what it takes to improve a community. It's also important to take a look at the strength of your collaborative partnerships, how engaged community members are, especially those who may not have formal power, those who are most vulnerable or who are experiencing the worst conditions for good health. It's important to look at how focused your priorities are based on a thorough assessment of needs, whether you're using evidence-informed strategies, whether you're focused on policy systems and environmental change as well as programs, and how well you're using evaluation to monitor and share results. So this 12-item self-assessment can help you identify what you're doing well to help make your community a healthier place to live, learn, work, and play, what you could do more of, and what you might want to start doing. The assessment is based on key steps in the Roadmaps to Health action cycle, as well as criteria that you'll see on the right that we use to evaluate communities for the Robert Wood Johnson Foundation Culture of Health Prize. So that wraps up our portion of this webinar, and we'd like to open now to your questions. And I'm going to see if Kate can tee us up for some questions here. So, Kate?
Yeah, so we've had a question come in from Ken, who is wondering, he lives in a rural community, I think this one's for Amanda, where they don't have a hospital. So in thinking about low birth weight, although in a rural community this may apply to some other measures, but he specifically is wondering about low birth weight, where women need to go outside of the county to deliver. where do those births get credited? In the county where the women live or in the county where the babies are born?
So for birth data and death data, the county that those births or deaths are placed into are the county of residence of the mother or the person who died, not where the death happened or where the birth happened. So the residents in your communities are counted when they're born or died in our data.
All right, great, thank you. So another data question coming in for Amanda, and that's are the measures calculated or data collected differently for rural and urban counties? Lots of rural questions.
Sure. Well, the challenges for measuring progress are only greater in rural areas. So I don't think there are any measures that are actually measured differently in rural or urban areas in the county health rankings. Every measure is treated the same way, actually. But it's important to note that for many of our measures, the reasons we combine so many years of data is so that we can access rural estimates of those measures. And for urban counties, most of the time, smaller numbers of combined years or single-year estimates would be available and more useful for measuring progress.
So just to follow up on that, this is Jan, are you suggesting that in rural counties maybe they go back and sort of think through what are some of their state data sources, you know, if they could get them at a more census tract level or zip code level, and really start with what their question is too?
Yes, they would want to think about what their primary objectives are, what they want to measure, and then I think going through our state pages and seeing what's available would be very important. In many states, especially those with large rural populations, states do additional surveying work so that their communities can get better data than we have available at the national level.
And on our site, we have a browse button or a search button where you can go in, just put your state's name in, and I think Kate chatted that also in the webinar. Just put your state's name in, and you'll see your state, and then you can click on that and get all sorts of data sources.
All sorts. They all were updated this year and are hopefully in a new and improved and better, easier format for you to access this year.
All right, a couple more data questions coming in. I think this is going to be a fun day for Amanda. So Amanda, can you just clarify with, as we are updating data year to year, we're dropping the last year of data, adding the new year of data, so it's always the 5-year pool?
In our combined years of data, yes, most of the time, the vast majority of the time, we will be adding one new year, the most recent year, and dropping the oldest year from the year before's estimate. That is, sometimes some of our data is combined across 3 years, some across 5 years, some across 7 years, but that I can think of only one data point where that changed from year to year. Our drinking water data, we decided to combine 2 years of data instead of just producing annual estimates this year. That's the only one that's ever changed.
And this is Kate. An important thing to think about with that too is that as you're looking, you know, if you're thinking about using the rankings to measure progress, you have a lot of overlapping data year to year. So you're not seeing the full change from one year to the next. So just another thing to consider when you're thinking about using more local data, that's one of the things with the rankings data to think about. A great question, I think, for Jan or for Amanda here, which is, I'm concerned about disparities in my community. Where can I find some information or data related to disparities?
Well, again, going to your state, searching for your state in the little browse button, and what will pop up will be a lot of different data sources. And on that chart, you'll also see, and we went through it during the webinar, but on the right-hand side, you'll see whether it's been broken out by subgroup and demographics and so forth. that would be a place. Anything else with that, Amanda?
That's really, I mean, we really tried to find all the state level sources we could that broke things down interestingly, either at the local level or at demographic subgroup levels. So that would be the first place I would start. I do think it's worth, if you're really interested in this, contacting your Department of Health Services or your Department of Public Health at the state level to see if they have any additional guidance for you. Great. Okay. Sorry, lots of questions coming in, so just scrolling through these here. Is there a way to download the data for my state and for the U.S.? Absolutely. There are a number of different ways to download the data. On your state page, there will be a way to download your state's data in an Excel workbook. And on the national download page, which you can access from the rankings menus, you can download the national data in Excel as a CSV file or as a SAS data set. You can also download all of the trends data, which differ slightly from the rankings data sets. And you can download that in a CSV or a SAS file with appropriate documentation as well. Okay, great. All right, so again, for Jan or for Amanda, we are in the 4th year of a Fit City Challenge, and we're wondering what data we might use to show if we're having an impact.
Great. We actually hear this question a lot from many communities. They've begun an intervention, a strategy, and it's been rolling along for a while, and it hasn't been evaluated yet. So one of the first things we would suggest you do is go into the Roadmaps Action Center, and I'll actually be taking you over there at the end of this webinar, and find the Evaluate Guide. In the Evaluate Guide, one of the first steps one of the key activities we suggest you do is prepare for evaluating by thinking through what was your strategy originally? What was your sort of theory of change? What were you trying to accomplish for whom? And then back up into what are some indicators of how would you know you've been successful, and those might be long-term health impact indicators as well as more along-the-way process indicators. And then back up from there, we provide you with some step-by-step guidance for thinking through then what would be the measures that would go along with those indicators that would tell you not only your the programs that you put in place or the policy and systems changes are having an impact, but that along the way your coalition is strong, that your communities are having more of a voice in the change process, whatever the key indicators are to you of success, because of course it's more than just the long-term health impact that we have on the community. And we'd also really encourage everyone that as you launch an initiative to go to the Evaluate Guide and think through those questions so that you can have those measures in place, the baselines and so forth, so that you're monitoring progress along the way. One wonderful thing that happens as a result is that you're able to communicate with your community, hey, this is what we're doing, this is the impact we're having, get on board. And it really is a great mobilizer and a great way to give feedback to your funders, if you have funders, and it's a great way to gather information to go out and secure more resources from grants and other sources. Amanda, do you have anything you want to add to that?
I think you really, it just reminded me that, you know, there is a whole other facet to, we really have talked heavily in this webinar about kind of measuring progress on outcomes. And there is a whole other facet of measuring progress in your community, measuring progress along the way to outcomes. I think you just said a lot of good things about that. So. All right, so we have a question just about, I'm assuming, like Salif is asking this, a question about including data sources on our into our website, which I'm assuming is your community coalition or maybe agency's website. Amanda, thoughts on that? Sure. Our data is all publicly available data. You're more than welcome to use it however you can use it best in your community. We love to hear about the ways you're using our data, so please feel free to contact us to let us know how it's being included on your website, or if you need some guidance about any of the pieces of data, just feel free to contact us.
So a great question coming in, I think, again, for either Amanda or Jan. We are located in a corner of a county that borders 3 other counties. Our 3 clinics are in 3 different counties. How would you suggest using the rankings in this situation? I've also gotten questions from counties that maybe are just across the state border and maybe use services across borders. Any thoughts or suggestions there?
That is just a really good question. And I guess my best, I think it would be important in that instance. Someone was asking about the question about where births and deaths are tracked. And I think it would be really important for communities like that to understand that. The answer to that question actually changes from measure to measure. And I'd be happy to talk with you about how that can change. So you'd have to think carefully about where the data is drawing from. And in some cases, it might be very useful to go back to our original data sources, especially as you're talking about healthcare data. We get much of our healthcare data from a source that can place providers even more specifically than the county level. And you might be able to use that to create your own boundaries of interest to you. I don't think that the county level is always appropriate for everyone's evaluation of measuring progress. So hopefully you can use our measures as guides and then move forward with the data sources.
Yeah, and I think Amanda's point of using the measures as guides, that we know that there are always situations with local communities where people are crossing county borders, crossing state borders. Again, the rankings are really intended as a conversation starter. So where you have more local data that makes more sense, you should use that. You should also hopefully use that as an opportunity to start talking about, are there differences in outcomes or in some of the measures between populations that are going to different communities. So again, the data starting point, but really the community conversation adds a lot of rich context and information that will really help you to fill in some of those question marks and think about the problem as a whole, and then identify where there really are some issues, and then thinking about those local solutions. So where maybe the data is challenging to use, think about using the model and the data as a starting point to really then move those conversations forward.
That sounds great. I think it sort of gets at this question, this is Jan again, about who is the community of interest? Who are you serving with your health improvement? Whose health? And just because we live in separate counties that may be across state lines, in a tri-county area, we may consider ourselves all one big community. And that happens in many different parts of our country. So perhaps to step back and sort of consider what kind of, I'll use the term dashboard, could we create that would be around the important measures that we know that we want to monitor over the long term for all of our citizens that are served in the tri-county region. So if you have 3 clinics, they might all feed into perhaps preventable hospital stays. So you'd have to sort of think that through as a coalition or a partnership, but really the question is, what is the shared measurement system that we could create around our community of interest? Is there another question, Kate? It looks like there's a lot coming in.
Just scrolling through. So is the data being used to monitor disparities in healthcare among aging populations in rural versus urban communities? Again, I think I'm going to take a stab at this, Amanda. The data is really meant to give counties a local picture of what's happening in health in their community. It's intended to, again, start those local level conversations. We bring the data down to as local a level as we really can, the county level. We know that isn't always the most local as people would like it, but it's really intended to be about local data, about local action, and that's really our motivation behind developing the county health rankings. And so we don't necessarily look at, we're not necessarily monitoring at this point disparities across populations. We're really providing a tool for communities to use to engage the broad community in discussions about health and take action.
And that said, I would add that if there's a hospital in your area, especially if it's a nonprofit hospital, they have a requirement to keep their nonprofit status that they have to do what's called community benefit. So they have to do a community health needs assessment. And within that community health needs assessment, they will have this data that you're looking for. In fact, hospitals have a tremendous amount of data, and so that's why it's so critical to have them be partnering with you at the table. And I think often it's just a question of finding out who has the data, who has that missing piece. And there may be multiple hospitals in an area, but again, bringing all that data together in one common pool and saying, okay, what's the question, and then how could we answer it with the local data that we have available. We're looking at questions right now. Is why there's great silence here.
I think we have a few that we'll probably answer offline as they're very specific to communities. If we can maybe just clarify one more time, though, births and deaths. They're calculated county of residence, not county of where the event took place.
Yeah, the only thing that I can, the only difference I can think of with regards to that is the alcohol-impaired driving deaths. Those deaths, that is different. They're not taken from, it's not taken from death certificates. It's a slightly different data source. Those deaths are calculated via where the accident happened, So there are some differences.
Okay.
So shall we take the rest offline? And if there's any further questions too, what I'm going to cover next is how to reach us as community coaches. So please feel free to contact us as well. This has been a really rich dialogue. Thank you all for your questions, and we hope that we've been able to answer to the best of our ability. We've been able to answer those. So I'm going to move on and take us back to the essential question that we started with as we bring this webinar home here. So we started with this essential question, and we hope you found some answers, but hopefully you have some new questions as well, maybe some different questions, which are really a good thing too. We have some additional resources that you may find useful in answering those questions. In the Roadmaps Action Center, Roadmaps to Health Action Center, I mentioned an Evaluate Actions Guide, and this provides guidance on evaluating both programs and policies. We had some pre-registration questions about how do we evaluate our coalitions? How do we evaluate for what a funder wants? So you can find some guidance in the Evaluate Guide for those questions. We have in there how to create a plan for evaluation, to determining the questions you want answered, to finding the data you need, and more. And then in the Communicate Guide, you'll find guidance for keeping your partners informed, engaged, and connected, and of course sharing progress is a key part of that. You'll also find tips for crafting your community story and tips for making presentations, among other key activities. I mentioned our community coaches. Thanks to the support of the Robert Wood Johnson Foundation, we have 4 community coaches in the County Health Rankings and Roadmaps program, and our assistance is no cost to you. So please don't hesitate to contact us if you need assistance with a tool, a question, a next step in your process. We're here to help, and you can find us also on the website. You can just click on a button there, and it'll take you right into our email system and directly over to us. Finally, you might want to check out our upcoming and archived webinars on our website. We do have another webinar coming up Tuesday, May 27th, that will focus on partnering with funders. And to learn more, you can sign up for our e-newsletter, and you can use social media to stay in touch with us and communicate. I believe Matthew Call has been tweeting about this webinar, so that's another way to follow along. And as we mentioned at the beginning of this webinar, the County Health Rankings and Roadmaps program is a result of the contributions of many partners, and we'll end by listing them here. We thank you for joining us on this webinar, and we look forward to hearing from you in the future. So thank you very much for joining us. Goodbye, and have a great afternoon.
Bye.